Yeah, so starting, my mic is not working. So starting with PSM, the first topic, that is HDI versus PQLI. The trick to remember what components are included in HDI and PQLI. Remember topics like this, which you know are definitely asked in the exam. And if you forget to revise one day before, I do not want you to make a mistake in this. Just because I did not revise before the exam, so I don't know the answer to this, right? So remember it with some tricks. HDI versus PQLI. Remember that for HDI, D for, remember, like D is doctor. Doctor does not kill, prevents from killing. So just remember, doctor is D wala doctor. The components are kill. That is, it is knowledge, income, and longevity. Knowledge, income, and longevity. Here in HDI, the longevity is life expectancy at birth, right? So that's the difference here that we should be aware of. This life expectancy at birth. Why in PQLI? Remember, for PQLI, the trick to remember PQLI is the little infant. PQLI is little. So in that little, the LI helps you to remember this is life expectancy at the age of 1 year. It is not at birth, it is at 1 year. The other L is for literacy and the infant is for infant mortality rate. So for PQLI, it is ending in LI. So remember, the mnemonic for PQLI is the little infant. LI wala is little infant. HDI wala doctor kill. And in your HDI, for knowledge, what is included here is schooling, the mean years of schooling. So for knowledge, it is the mean years of schooling. HDI basically is for D for standard of living. HDI, DD is for standard of living. PQLI, QL, it is for quality of life. So HDI is standard, PQLI is quality. We have seen what kill is: knowledge, income, and longevity. So remember these components: HDI, doctor, kill, and PQLI is little infant. Coming to levels of prevention: primary, secondary, tertiary. Whenever you are asked question on this, the levels of prevention, what you have to see is the preventive measure that we are taking. Is it before the disease or after the disease? What starts after the disease? Which prevention is after the disease? Secondary, right? So what you have to see first is disease hai ki nahi hai. When are we starting this measure? If it is before the disease, it could be primordial, primary. With the disease, it is secondary and tertiary. So what is primordial prevention? Primordial basically means decreasing the risk factor itself. So lifestyle modification, environmental measures, preventing the coronary artery disease by decreasing childhood obesity. This is previously asked question, basically are all primordial measures. So when you are decreasing the risk factor itself, it is primordial. Primary matlab, the risk factor is present, but you are preventing the disease to occur. So in primary, basically you have health promotion and specific protection. So health promotion, like hand washing. Specific protection, vaccine is a specific protection. It protects against a specific disease. Chemoprophylaxis, like for malaria, it is a specific protection. Iron folic acid supplementation, it's a specific protection. All of these will come in your primary. The disease has not occurred yet. So health promotion, specific protection, primary. What comes in secondary? Early diagnosis and treatment. Jab disease ho gaya, then it has to be early diagnosis and treatment. How do we do early diagnosis? By screening. Example, pap smear for CA cervix. It's a screening. It's an early diagnosis. Treatment like ART, anti-tubercular, antiretroviral, the treatment will come in secondary. Early diagnosis, treatment. Tertiary is rehabilitation, like prosthesis, use of crutches. This is rehabilitation. So remember that secondary is basically for disability prevention or limitation. Is it prevention or limitation? Disability prevention. And tertiary rehabilitation means disability limitation. So remember that one word here and there will change your answer. Disability prevention पूछा है, disability limitation पूछा है. So now spectacles. Right, using spectacles for refractive error. Is it primary, secondary, tertiary, primordial? What prevention? Yes. Spectacles is disability limitation. We are using the spectacles. If we remove the spectacles, is the disease treated? Is the refractive error treated? No, it's just a disability limitation. So remember that spectacles will come here. It's not a treatment. The disease is not cured. Why? LASIK. LASIK will come under secondary, right? It's a treatment. So LASIK is the treatment. It will come under secondary. Post-exposure prophylaxis, rabies, tetanus, that will come under secondary. Disease already हो चुकी है, rabies or tetanus हो चुका है already. नहीं हुआ. It is before the disease. So always think, has the disease occurred or not occurred? It is before the disease, it is specific protection, and that is why it will come under primary. Right, so remember that primary is health promotion, specific protection, vaccines, chemoprophylaxis, pre-exposure prophylaxis, hand washing, iron folic, all of this is primary. Secondary is early diagnosis treatment, screening, so MDT, ART, LASIK is a treatment. All the checkups, health checkup, school health checkup, is secondary. When you're doing a health checkup, basically you are aiming at early diagnosis. So health checkup is secondary. Tertiary, amputations, transplant, polio, all this is tertiary. One of the recent NEET PG exam question, prospective screening, prescriptive screening. You should know that which is primary, which is secondary. So to remember that prospective is a screening which is done for a larger prospect. Right, prospective is a larger prospect. It is for a larger prospect. And it's a primary because you do it in healthy individuals, not in the diseased. Example of prospective screening is before blood donation, basically checking for HIV. So you do that even when the disease is not there. So this is for a larger prospect to prevent the disease transmission. So remember, this is primary. While prescription हम किसको देते हैं? The doctor gives the prescription to a patient. That is a case. That means the disease is already present. So this will be what screening? This will be what prevention? Secondary prevention. So remember, prospective is for a larger prospect in healthy individuals. Primary, prescriptive is secondary. So this is primary, this is secondary. That's about the levels of prevention. Coming to epidemiology, the disease transmission, understanding some terms like what is the generation time, what is the serial interval, incubation period, isolation, quarantine, right? The terminologies here are important. What is a primary case, what is an index case, and what is a secondary case? Primary case, matlab, as the term says, the first case that is happening in the community, right? But what is the index case? The first that comes to notice. The first observed by the investigator is the index. Remember, IN. Investigator को जो सबसे पहले दिखता है वो है index. So suppose that I was the first primary case who got COVID. I gave it to someone else. The investigator does not find me, but the investigator finds this person. So I become the primary case, the first person to be observed to be noticed by investigator is the index case. What is the secondary case? Anything which is coming from primary, that's a secondary case. So important index is investigator. What is serial interval and what is generation time? Serial interval means, remember SSS. Symptoms in primary to symptoms in secondary case. How much time is required is your serial interval. Right, so SSS is symptoms in primary to symptoms in secondary is your serial interval. While generation time basically is for, remember, C and G. The alphabet C and G look similar. We saw this somewhere yesterday also. C is like G. Cylinder color में anesthesia में what was that? Gray color. किसका gray था? Carbon dioxide. Cyclopropane का क्या था? Orange. Right? कौन सा vaporizer orange था? कौन सा vaporizer? Hello was red. Eno, भूले Eno. Enfluorine is orange, right? Again a proof that एक बार सुन के याद नहीं होने वाला, रिविजन करना पड़ेगा, ठीक है? So remember that time between entry of organism and the maximum communicability. So generation time is related to the maximum communicability. In maximum, at what time am I becoming infective? I can communicate the disease to someone else. That is the generation time. What is incubation period? You read incubation period for various diseases. Incubation matlab time between entry of organism and appearance of the first symptom sign. That is incubation. What is isolation and what is quarantine? Right, quarantine. COVID में quarantine कर रहे थे. कब quarantine कर रहे थे? Someone is traveling from a high prevalence area. सबको quarantine कर रहे थे. Were all the individuals who were quarantined, were they having the disease? No. So quarantine is primary or secondary? Are you doing in healthy or diseased? Healthy. So remember that quarantine is primary. We are doing this before the disease itself. So remember that quarantine is done in healthy people. For how much duration do you do the quarantine? For the maximum incubation period. So when you are sure that अगर अभी तक symptoms नहीं आए हैं, that means अभी symptoms नहीं आने वाले इसमें, the person is not having the disease. So that is the incubation period. It is done for maximum incubation period. While isolation, whom do we isolate? Right? COVID होने के बाद हम isolate कर रहे हैं. So it is what level of prevention? Secondary. For how much duration are we doing isolation? Maximum communicable period. That is basically the infectivity वाला period. जब तक पता है कि अगर अभी इसको छोड़ दिया तो अभी किसी को infection नहीं देने वाला है. So that is the time we do the isolation. The communicable, maximum communicable period. So this is done in diseased people for maximum communicable period. So remember, quarantine is primary, isolation is secondary. So if you are given an image-based question like this and you are asked which of these is generation, which of these is serial. What is the image showing here? This is the primary and the secondary. पहले infection हुआ, organism आया, फिर symptoms हुए, transmit किया. So remember that symptoms to symptoms. What is this going to be? Serial interval. So S to S. This will be your serial interval. While infection to infection. Transmitting the infection, communicating the infection, this is going to be the generation interval. So generation interval is I to I. Right? GHI, the G and I come close together. So infection to infection, communicability. What will this represent? If the diagram is showing this, what will this represent? Incubation period. Infection के बाद symptoms आने के लिए कितना time लग रहा है in that same person. So this is the incubation period. Right, so this is asked as an image-based question also, which is the serial interval, generation, and the incubation period. Coming to epidemiological study. Before we see this, let's see this flow chart of epidemiological studies. So the epidemiological studies can be experimental or they can be non-experimental. Experiment matlab, we are doing an experiment. We are intervening and doing some experiment. So remember that experimental is interventional. Example, randomized control trial. What are we intervening here? Like a new drug. Right? So we are intervening. We are giving the new drug to the patients. So it's experimented. RCT is done in what phase of clinical trial? Phase 3. RCT, 3 words. So RCT is your interventional experimental. The rest of them, you are not intervening. Non-experimental means not intervening, just observing. So non-experimental or observational. In that, either it is descriptive or analytical. What is descriptive? What is analytical? Descriptive matlab you are just describing, right? So let's say that in my residency, I see some cases, like let's say I see 3 patients who are taking metronidazole and they got cerebellar altered signal intensity on MRI. So I make that case series. Like I describe 3 patients taking metronidazole showed this on MRI. So I am just describing it. So we are formulating the hypothesis, right? That this could be possible, that it is because of metronidazole. So remember that case report, case series is just descriptive. Case report matlab a single case series matlab multiple cases presenting with the same features. So we are formulating the hypothesis here. Analytical means the ones which are testing the hypothesis. So to prove that whether it is actually significant, it is non-significant. So your case control cohort studies where you talk about the relative risk, the odds ratio, where you are actually testing the hypothesis, these will come under analytical. Are they experimental? Are you intervening? No, it is just non-experimental or observational. So remember that in analytical, we are just testing the hypothesis, whether it is significant or non-significant. The comparison group is present, right? You have smokers with lung cancer, non-smokers, lung cancer. So you compare कि किसमें lung cancer ज़्यादा है. So which is that study, analytical study where population is the study unit, not the individual. It's the population. That is ecological study. All these are questions which are asked. Ecological study is the study where population is the study unit, while the rest of them, it is individual. So you have cross-sectional, case control, and cohort. So we come to cross-sectional, case control, and cohort. So if this is starting with, right, the past state, the present state, and the future. Okay, past, present, and future. A study which is done only in the present without diving into the past or without following it up into the future is what study? Cross-sectional. Cross-sectional matlab you are taking a cross-section at one point of time. So imagine you are taking a cross-section at single point of time at one level. That is the present level. So what is happening in the present is what you see here. So what will I get to know if I see the present condition? Basically, it will help me to see the prevalence of a disease. So cross-sectional is just for prevalence. What is the status of the disease in the community? What is the difference between prevalence and incidence? Incidence means new cases only. Prevalence matlab old plus new. It includes all the cases. And remember the formula for prevalence is PID. Prevalence is incidence into duration. The more the incidence, the new cases adding up, of course, the prevalence will increase. The more the duration of the disease, the prevalence will increase. So anything which will decrease the duration of the disease, what is that? For example, treatment. अगर आप treat कर रहे हो disease को, what will happen to the duration of the disease? Decrease हो जाएगा ना, disease जल्दी चले जाएगा. The duration will decrease and therefore the prevalence will decrease. Disease कम हो जाएगी in the community, right? So remember that prevalence is incidence into duration, PID. So single point of time is a cross section. Now following it up is case control and cohort, right? So it is, what is the difference between case control and a cohort study? How do you start the case control study? Case control. What is the word starting with? Case. So remember, it starts with case. What do you mean by case? Disease present. So it starts with the disease. So in case control, you start with the disease. That's a case, that is, let's say, patients with lung cancer, patients without lung cancer. So you have the cases and you have their respective controls, with lung cancer, without lung cancer. And then you follow them backwards. You ask them the history. Are you a smoker? How much did you smoke? All of that. So then you look for the exposure. So you start with the disease state and then you ask the past history. So in case control, what bias will be there? What bias? Recall bias. है ना, recall bias. अब patient तुमको सही बता रहा है, नहीं बता रहा है कि smoke किया, नहीं किया, कितना किया. So there's going to be a recall bias. It is based on recall. Like we see the recall bias post exam. कुछ लोग को तो ऐसा लगेगा अच्छा ये क्वेश्चन था भी एग्जाम में, राइट? या कुछ लोग जस्ट टू प्रूव जस्ट टू गेट दैट इफेक्ट कि नहीं मेरा आंसर सही है, they'll modify the question. So that's going to be a recall bias. So that's the past. On the other hand, if you start with the risk factor, that is non-disease state, and then you follow it up कि disease हो रहा है कि नहीं हो रहा है, then that becomes a cohort study. That becomes a cohort study. So remember that cohort starts with the risk factor. So smokers, non-smokers, whether they are developing lung cancer or not, that is a cohort study. So cohort study is generally a prospective study. In the future, we are following it up. Can we have a retrospective cohort study? We can have retrospective, we can have ambespective. कि past से present आ रहे हैं, present से future जाते हैं. The only thing that you need to remember in cohort is the direction in cohort is always forward. It is always forward. That means either going from past to present or present to future. If you start from the past, that becomes your retrospective cohort. If you start from the present and go into the future, it becomes your prospective cohort. So the only thing that you need to remember is cohort is a forward direction. It will be past to present, present to future. If you're going from present to past, that becomes your case control study. Backward direction is a case control. You start with the disease. So what study will this be? We have a group of smokers. We have non-smokers. We follow them for 5 years and we see whether they are developing lung cancer or no. What is this? Cohort study. Okay, that's a cohort study. In ecological study, what is the study unit? Population. So what do we use here? The data resource is the data matching population. Remember, this is population based. So this table, cohort study, case control studies are longitudinal, horizontal. Longitudinal matlab you are following them up, either पीछे या आगे. So remember, these are longitudinal. while a cross-sectional study is horizontal, एक point पे. Ecological study, horizontal. For ecological, it is population. For rest of them, it is individual. What is a nested case control study? Is it a case control study or is it a cohort study? Cohort. Remember, nested case control is a misnomer. Actually, it's a cohort. So when do we do a nested case control study? Is when you have a rare disease or expensive investigation is involved for that disease. So what do we do is nested. Matlab we do it within one nest only. So before we start the study, let's say we are trying to see at a new inborn error of metabolism, right? We want to do a study on that. So we start with a group which is like 100 newborn. We select a nest of 100 newborn and we will do the study in that nest only. Remember, we start with one nest, right? So when it's a rare or expensive investigation, we do nested case control study. So like we said, suppose we are taking this 100 newborns. This is the one nest that we are starting with. So you are starting in the present. You are following these newborn in the future to see whether the disease is occurring or not occurring. So what study pattern is this? Case control or cohort? Cohort. Because are you starting with the disease? No. So remember, this is cohort. It is starting in the non-diseased state. So how do we do this nested case control is, let's say that we have two newborns who develop the disease when we are following them up. So for these two newborns which become the case, from that group itself, we take two other newborns who do not have the disease, that is the control. So for every case, then we take a control. And that's how the study goes on. So this is a case and a control. But within the nest itself, you are starting from present into future. So actually, it's a cohort study. So you do it for rare, expensive investigations. Nested case control. In cohort study, what is the problem in cohort? Attrition. What do you mean by attrition? Loss to follow. Right? Smokers liye aapne, non-smokers liye, and you're following for 5 years. Cancer hua ki nahi hua. There are high chances that the people will not turn back, so when you want to investigate. So loss to follow-up, attrition bias will be the problem in cohort. In case control, the problem will be the recall bias. Right, so this is what we have already seen. Cross-sectional study is at a single point of time in the present state. That means it helps for prevalence, right? If you start with the case and you go for exposure, this becomes a case control. Cohort is a forward direction, past to present to future. In which study do you have odds ratio? Where do you get relative risk? Where do you get incidence? Case control basically gives you the odds ratio. Remember it as control, case control. Control the case in the OR, that is operating room. Control case in OR, odds ratio. Rest everything is cohort. So in the case control the case in OR, rest everything is cohort. So relative risk, incidence, all this basically comes from the cohort. Relative risk, attributable risk, incidence, you get to know in cohort. So when do you say that there is a positive association or it's a risk factor? When the odds ratio or relative risk should be more than 1, right? It's a risk factor. If the relative risk or odds ratio is 1 matlab none association. So remember that the relative risk odds ratio is not 0 to say that it's a no association. It is 1. 1 matlab equal. Non-smokers, smokers, दोनों में equal chance है lung cancer का. That means there is no association. If it is less than 1, then it becomes a protective factor. Example of a protective factor, basically vaccine. Right, that's a protective factor. So remember that 1 matlab none association, more than 1 is risk factor, less than 1 is protective. What is the best study design for multiple exposure if you want to study? Case control or cohort? Case control. Because what do you start the case control with? Disease. So let's say you are starting with lung cancer. जब आप पेशेंट को हिस्ट्री पूछ रहे हो सिर्फ स्मोकिंग की नहीं और बहुत सारी हिस्ट्री पूछ सकते हो, राइट? So yeah, there are multiple exposures that you can ask for. The strength of association in case control study is given by OR, odds ratio. Best study design for multiple outcome. Smokers, whether they are developing lung cancer, stomach cancer, bladder cancer in the future. So 1 exposure, multiple outcomes. This will be done in cohort, right? Whether smoking is leading to lung cancer, COPD, gastric cancer. All of this you can study in a cohort. So remember that multiple exposure के लिए case control, multiple outcomes के लिए cohort. Coming to the formulas for odds ratio, relative risk and attributable risk. Odds ratio is case control, rest of them is cohort. Remember that the odds ratio is basically ODD is OPP, opposite ratio. What do you mean by opposite? AD upon BC. So you have this table where you have disease present, disease absent, exposure present, exposure absent. Please remember that the A, B, C, D is not like this. ये A है, ये B है, ये C है, ये D है, ऐसा नहीं है. It is A, B, C, D. Okay, so remember it like it goes like this: A, B, C, D. So AD upon BC. So odds ratio is opposite ratio, that is diagonally opposite ratio, which is also called as crossover ratio. These are the multiple terms that can come. Calculate the crossover ratio. Crossover matlab cross karke ratio lo, that is odds ratio. What is the formula for the relative risk? Relative risk is easy. Incidence exposed upon incidence, non-exposed. Right, so incidence in exposed. Who are the total exposed people here? A plus B. Out of that, how many are getting the disease? A. Who are the total non-exposed? C plus D. Out of that, how many are getting the disease? C. So it is A upon A plus B and C upon C plus D. Incidence exposed upon incidence non-exposed. And what is the formula for attributable risk? Attributable is the one where subtraction comes into play. Remember attributable, ATR, subtraction wala formula is for attributable risk. So it is incidence exposed minus subtraction, the incidence non-exposed upon the incidence exposed. जो first term होगा यहाँ वही denominator में आएगा. Incidence exposed minus incidence non-exposed upon incidence exposed. What do you mean by attributable risk? Attributable risk basically means how much percentage of the cases are attributed to that risk factor. So how will I get to know that? So in the question they give you that when we stop the smoking, we see that the lung cancer reduces by 80%. So what does this 80% indicate basically? It is the attributable risk. This is how the question comes. So if I say that the attributable risk is 80% for smoking and lung cancer association, that means that if I stop the smoking, that percentage of cases will go less, will reduce by 80%. And what is the formula for population attributable risk? Now we replace the incidence exposed here by incidence, total population, total population. तो जो पहले आएगा वही नीचे आएगा. So incidence in total population minus the incidence in non-exposed upon incidence total population. Right. So if I tell you that out of 100 smokers, 10 develop lung cancer, and out of 100 non-smokers, 5 develop lung cancer. What will be the relative risk here? Incidence upon in exposed. What is the formula for relative risk? IE upon INE. But incidence exposed, incidence non-exposed. What is the incidence exposed here? You have to take it as 10 upon 100. Sirf 10 mat lena. 10 upon 100 divided by 5 upon 100. So that will give you, if you calculate, basically it will come 2. Just don't take it as 10 by 5. You have to take into consideration ki total ye kitne hai. Right, so that's how you calculate the relative risk. So is it a risk factor if the relative risk is 2? Yes, it is more than 1. So that is suggestive of it's a risk factor. If I tell you that COVID vaccine, people who received COVID vaccine, 100 people out of 100 who received the vaccine, 2 turned out to be COVID positive. जिन्होंने vaccine नहीं लिया था, out of 100, 8 turned out to be COVID positive. What will be the relative risk here? Incidence exposed, incidence non-exposed. Exposed to COVID, how much is that? 2 upon 100 divided by 8 by 100. कितना आएगा ये value? If you calculate, it will come to 0.25. So is it a risk factor or a protective factor? Protective. Why protective? Less than 1. Remember, it's not more than 0. It's less than 1 which is taken into consideration. What is the formula for relative risk reduction? Something asked in your INICET exam. Relative risk reduction basically is reduction मतलब reduce करो minus 1 minus the relative risk. So if the question is calculate the relative risk reduction. So for this COVID wala case, so it is 1 minus 0.25, that will come to 0.75. So the formula for relative risk reduction is 1 minus RR. This is just the revision of the formulas here, basically that you have, the summary of the formulas. Odds ratio is AD upon BC. Relative risk is IE upon NIE. Attributable has the subtraction. Population, you replace here with population. Relative risk reduction is 1 minus relative risk. Okay? Done with the epidemiological studies. Where do you have population as the study unit? Ecological. In which study are you seeing the prevalence? Cross-sectional. Cross-sectional is horizontal or longitudinal? Horizontal. Case control is an example of, is it an experimental or an observational study? Observational. Is it descriptive, analytical? Analytical. Which is descriptive? Case series, where you are just describing the cases. You are not testing the hypothesis, you are formulating the hypothesis. So revise all of this. The advantage of revising soon after classes, you will remember how did we say this and how did we remember this. तो बहुत बार क्या होगा कि याद ही नहीं रहेगा कि ये कैसे याद किया था और क्या बोला था. If you revise it early, you will actually remember. Okay, so how this was discussed. Going to the next one, vaccines. Right, the most dreaded topic, be it in PS and pediatrics. So in vaccines, most important, the delayed immunization age. So they give you that a child did not receive vaccine, child का age इतना है अभी तो कौन सी vaccine दोगे, कौन सी नहीं दोगे. So remember that the delayed immunization age limits is till the age of 1 year. Okay, this is where we have written this with the mnemonics. For the delayed immunization state, what vaccine can you give till 1 year of age? Remember, birth. 1 year ka, that means till the time the child is an infant. 1 year. It's very important to do what in an infant after feeding? Burping. So remember that 1 year is burping. Burp. What is this burp here? Burp is BCG, IPV, Rota, penta. Right? So this is birth. BCG, IPV, rota, penta. What vaccine can you give till 5 years? 5 is 5MO. Remember it as 5MO. M for measles, O for OPV. Measles के साथ हम क्या देते हैं? Vitamin A. Vitamin A is given with measles. So remember it is measles, OPV and vitamin A. DPT. T is like 7. Okay, T is 7. So DPT can be given till 7 years. Japanese encephalitis. You can remember this Japanese encephalitis. J and E. J is 1, E is 5. 15. Or you can remember J for a jawan bachcha. कब जवान हो रहा है? 15 साल पे. So Japanese is still 15 years. So you have DPT 7. This is 15. Hepatitis B needs to be given within 24 hours. So what vaccines are given at birth? BCG, right? We all receive BCG, OPV, hepatitis B. Now, so remember it as when the child is born, that is at birth. कौन सा birthday है उसका? 0. For 1 year complete, 1 birthday. अभी तो 0 year है, तो 0 birthday. So remember this is happy birthday 0. So happy is hepatitis B, BCG and OPV. Out of that, hepatitis B has to be given till 24 hours. BCG we have seen is birth. It can be given till 1 year and OPV can be given till 15 days. This is the 0 dose of OPV that we are talking about, the birth dose. So remember, hepatitis B, the 0 dose at birth wala within 24 hours. This is 15 days. This is 1 year. Coming to adverse events of vaccines. Thrombocytopenia, toxic shock syndrome are the adverse events with measles MR vaccine. Important, intersusception is an adverse event with rotavirus. Remember, rotavirus is a virus which is known to cause diarrhea in infants. So diarrhea related to GIT, intersusception karega. So rota is intestine wala intersusception. GBS is seen with influenza. What did we see in CSF for GBS? Albuminocytological dissociation. Albumin, proteins increase, but the cells not increased. Why did we say? Because it's an immunological process. It's not an infective process. Remember, GBS is immunological. Influenza, II. Influenza vaccine is GBS. Inconsolable cry is seen with DPT. And इसमें भी कौन सा component is responsible for this? Pertussis. So the question is, DPT दिया बच्चे को, उसके बाद inconsolable cry हुआ, तो next dose दोगे कि नहीं दोगे? You will give the next dose. Inconsolable cry is not a contraindication to give the next dose. What is a contraindication for vaccine is? Absolute contraindication is anaphylaxis. Inconsolable cry is not a contraindication. You need to take precaution, but give the next dose. Yes, if the side effect here is HHE, hypertensive, hyporesponsive episode, then that's a contraindication. Inconsolable cry is not a contraindication. What vaccine is contraindicated in egg allergy? Egg allergy. Egg allergy, remember it is yellow fever. What is the color of the egg yolk? Yellow. So remember that yellow fever and egg are related. What anesthetic drug did we see egg allergy mein nahi doge? Propofol. How did we remember? Egg protein. Right? Propofol, egg allergy. Yellow fever, not in egg allergy. What vaccine is contraindicated in progressive neurological disorder? Pertussis. Example of that, seizures. Cerebral palsy is not a progressive disorder, it's a static disorder. So it is not a contraindication. CP is a static disorder. It's not a contraindication, while seizures, progressive neurological pertussis is contraindicated. Coming to the heat sensitivity and the freeze sensitivity. So when you have that ice lined refrigerator, bottom and the top, right? So in that, which is the सबसे cool वाला, सबसे कम temperature कहाँ होता है? Top में कि bottom में? Bottom. So imagine like if this is the box and you open the box. The top layer of the box is exposed to environment. That means it will not be very cold. जो नीचे है, that's going to be cold, right? So the temperature is less below, the temperature is more above. So the vaccines which are heat sensitive, you'll keep them at the top or you'll keep them at the bottom. Bottom. जहाँ ठंडा है वहाँ रखना पड़ेगा heat sensitive vaccines, right? So remember that the most heat sensitive vaccines, they'll be kept at the bottom or the top? Bottom, which is the coolest part. So which are the heat sensitive vaccines? Remember bottom, BO. So that is BCG, OPV. Reconstituted BCG is more heat sensitive than OPV. Reconstituted is what we are talking about. Reconstituted BCG is more heat sensitive than OPV. How do you reconstitute the BCG? Water, normal saline. BCG is constituted with normal saline. Normal saline. Most freeze sensitive vaccine. Where will you keep them? Top की bottom. Freeze sensitive है मतलब उनको ठंडा नहीं चाहिए, उनको गर्म चाहिए, तो उनको कहाँ रखोगे? Top में. So remember at the top, T. The T wale vaccines, that is hepatitis, DPT. These are freeze sensitive. TT top, they are freeze sensitive. How do I know whether the vaccine was exposed to heat and that's why it has lost its potency? What is that? Vaccine vial monitor tells you about heat exposure, damage by heat exposure, and for cold exposure, it is the shake test. What is the cold chain temperature of vaccines? What is the temperature? 2 to 8 degrees centigrade, right? It's not negative. It is 2 to 8. जो हमारा refrigerator का temperature होता है 2 to 8. The most important equipment in the cold chain is the ice-lined refrigerator. So since we were discussing about the vaccine vial monitor, let's quickly see the vaccine vial monitor. Important points here. Vaccine vial monitor, where you have this on the vaccine ka label. Remember that andar wala is square. It is not a circle within a square. It is a square within a circle. Even this has been asked. It's a square within a circle. The chemical is present in the inner square, right? Which shows the color change. What shows the color change? The inner square or the outer circle? Inner square, because there's a chemical which will show the color change. So vaccine vial monitor basically is for heat damage. Suppose I have a vaccine. The vaccine vial monitor status is good, but the vaccine is expired. Can I use this vaccine? Yes or no? I cannot use this vaccine because its expiry ho chuki hai, even if it is not heat damaged. So remember that vaccine vial monitor has nothing to do with the expiry. It does not prolong the expiry of the vaccine. So when do you use the vaccine and when do you discard the vaccine? Vaccine vial monitor. So remember that the trick is till the square is light, the inner square is light, you take it light. तब तक टेंशन नहीं लेना, ठीक है? जब तक अंदर का लाइट है, take it light. So when it is lighter, be it white or be it light, it can be used. If it becomes same color or if it becomes dark, you will not use. So if you see that the inner is light, you take it light and give the vaccine. Right, very important image-based question. For freeze, it is the shake test. Freeze damage, it is the shake test. Right, so coming back to here, the important strains for the vaccines. 17D is a strain for which vaccine? Yellow fever. Remember it as yellow, dirty fellow. So it is D. Dirty fellow is the yellow. 17D. Yellow fever vaccine is a live vaccine or a killed vaccine? It's a live vaccine. Remember that some examples of live vaccine where you have LL is live. Yellow, rubella, varicella. LL is live. Yellow, rubella, varicella. OPV, IPV, which is the live vaccine? OPV, something which you are giving oral, it's a live. So which is the live polio vaccine? Sabin. Which is the killed one? Salk. Remember Salk ending in K, it's a killed vaccine. IPV is killed. OPV is live. Which is the other vaccine that we give oral? Rota. Intestine, rota. So rota bhi kya hoga? Live. Is rubella live? Yes, LL. So out of the RRR, rubella, rota, rabies, which is a killed vaccine? Rabies. You cannot take the risk of giving a live rabies vaccine. अगर rabies हो गया तो उसमें है 100% case fatality rate. The disease with 100% case fatality is rabies. So you will give their killed vaccine. Rabies is a killed vaccine. So 17D is for yellow fever. Gerillin is a strain for mumps. Remember Gerillin. Tom and Jerry jumps. Tom and Jerry keep jumping. Remember Jerry is jumps, that is mumps. For Japanese encephalitis, what is the age for Japanese encephalitis? Delayed immunization? 15 years. Japanese. So imagine Japanese language है, समझेगी किसी को? नहीं समझेगी. It's like a code language. So Nagayama, like a place in Japan, is what you can remember. And this is the code language. पता नहीं क्या बोल रहे हैं? 1442. Right? Talking in the code language. That's a Japanese encephalitis. हमने कहीं टाकायामा देखा था? ये नागायामा है. टाकायामा? Sorry? Blood test. Remember the blood test? कौन सी थी? टाकायामा और टिकमैन और बेंजीडीन और फिनाक्सिलिन और स्पेक्ट्रोस्कोपी इज द बेस्ट. और कौन सी थी? He-man, Tickman, having a castle in Takayama, wearing the spectacles, bloody benzidine, right? So remember that was also the castle mayor test. Right, the castle mayor. So He-man having a castle in Takayama. All these were the tests for blood. Best was spectroscopy. This is Nagayama, Japan. कल कौन से ल्यूकेमिया लिम्फोमा में देखा था? चाइना जापान का पेशेंट होगा, क्यूटेनियस लीजन्स होंगे. क्यूटेनियस लीजन्स, चाइना जापान, हाइपरकैल्सीमिया, क्लोवर लीफ, CCC, HTLV. What disease was that? Remember cat, C was for ATLL. Revise karo, right? You will see the maximum benefit of this class only when you revise. Next is RA273 is your strain for rubella. Remember the rubella RNA starting with R ending in A, RA273. Then you have for BCG it is Danish 1331. Malaria is RTS. Remember malaria, RTS, S sporozoites malaria. Measles is M Edmonston, Zagreb and the Schwartz. So you have M, ES and S. That is Moraton. ES is Edmonston, Zagreb and the Schwartz. M, ES and S. Varicella, that is chicken pox. Varicella has various names. Like, it is also called chicken pox. So varicella, akka. What is akka? Telugu wala akka nahi. Right? Ye wala, English wala. It is also known as. So remember that varicella is oka. Akka, oka. Oka strain. Varicella, various names, akka, oka. Oka strain. Coming to open vial policy. Right, the open vial policy. What is the open vial policy? Vial खोलने के बाद till how much time you can use that particular vaccine vial? Maximum कब तक होता है? 28 days. Open vial policy 28 days. So which vaccines follow the open vial policy? That means they can be reused till 28 days, which do not follow. So remember that open vial policy is basically followed by TPO. Open TPO. So all the T containing vaccines, hepatitis, TT, DPT, Penta. अभी कौन सा ऐड हो गया है? रोटा, द न्यू रोटा. पहले रोटा नहीं था, अभी द न्यू रोटा टी है इसमें, ये भी आ गया. पहले जापानीज एन्सेफेलाइटिस भी नहीं था, बट देन दे रियलाइज कि अरे इसमें भी टी है, इसको भी डालना पड़ेगा. राइट, सो टू मेक माई निमोनिक ट्रू, इन्होंने इसको भी ऐड कर दिया, रोटा को भी ऐड कर दिया. राइट, सो रोटा, जापानीज एन्सेफेलाइटिस, द न्यू वंस, these have been updated that these follow the open vial policy. कौन सा वाला? जापानीज एन्सेफेलाइटिस का कौन सा? किल्ड वैक्सीन. So TTT, TPO, IPV, OPV, right, and the pentavalent or PCV. This also follows your open vial policy. PCV, IPV, OPV. What does not follow the open vial policy are the rest of them. So all the vaccines which you see are reconstituted or they are available in the powder form. If you are reconstituting, that means उनकी stability इतनी नहीं है, you cannot use them for long. So example, MR, BCG, Japanese encephalitis and the old rota. MR vaccine is reconstituted with water. Remember, M is W. It is water. While BCG is reconstituted with saline. Phosphate buffer is in Japanese encephalitis. Phosphate buffer has been asked as Japanese encephalitis. So how do I know the Rota vaccine? Is this the Purana vaccine or the Naya vaccine? Whether this follows the open vial policy or it does not follow the open vial policy. So remember that the new Rota vaccine which follows the open vial policy will have the vaccine vial monitor on the label. Right? So अगर ये vaccine का vial है, you will see the VVM here on the label. जो पुराना वाला है, उसका वैक्सीन वाल मॉनिटर इज ऑन द कैप. तो नया वाला जहां पे वायल के अंदर वैक्सीन है, उसके बाजू में बेसिकली द वैक्सीन वाल मॉनिटर इज देयर. दैट मींस यू आर फॉलोइंग देयर. कोविड आल्सो डज नॉट फॉलो द ओपन वायल पॉलिसी. कोविड वैक्सीन. Right, so we've already seen what follows, what does not follow. Remember, TPO follows. The rest of them do not follow, which are reconstituted. Old Rota has VVM on the cap. That does not follow. The new one follows. Right, vaccine vial monitor is done. Coming to national immunization schedule. The diluents we have already seen. The reconstituted कौन से हैं, किससे reconstitute करते हैं? Pentavalent vaccine में basically क्या है? 5 चीजें. DPT, hepatitis B and Hib. यहाँ पे न्यूमोकोकल है क्या? नहीं. It is important to give pneumococcal vaccine in patients who have undergone splenectomy. Right? Splenectomy अगर हो गया है तो pneumococcal vaccine, Hib vaccine is important. Now, which vaccine is given in the right arm, which is given in the left arm, which is given dermal, which is given subcutaneous, 0.1 ml, 0.5 ml. So this is to be remembered with the right arm and the left arm. So you do it on yourself, then you remember it well that on the right arm, basically it goes like I, M, B, J. Okay? I, M, B, J. So the sequence is I, M, B, J. Right? I, M, B, J. So start from the right up, I, M, B, J. The vaccines, the alphabet which you are having on the top, they are given 0.1 ml dose. जो नीचे है M और J, it is 0.5. जो ऊपर है वो है dermal, जो नीचे है वो है subcutaneous. So when I say I, M, B, J, the I and the B, what is the I and the B? IPV and BCG. तो अगर क्वेश्चन आएगा BCG कितना डोज देते हैं? 0.1 ml इंट्राडर्म. Measles, Japanese encephalitis. Measles, Japanese encephalitis कितना देते हैं? 0.5 ml subcutaneous. तो ऊपर वाला छोटा नंबर, छोटा अल्फाबेट डर्मल, नीचे वाला बड़ा नंबर 0.5, बाद वाला अल्फाबेट सबक्यूटेनियस. 0.1 dermal, 0.5 subcutaneous. Giving the tetanus vaccine in pregnancy, remember now it is not TT. What is recommended? TD. Okay, now it is TD. So in pregnancy, we give 2 doses of TD. First to be given as early as possible. Next to be given out of after how much gap? 4 weeks. Right, so the question asked is कि a female है जिसका अभी एक बच्चा है जो 2 साल का है. She is pregnant again. She received the complete tetanus vaccination in previous pregnancy. So how many doses will you give now? No dose, 1 dose, 2 dose. 1 dose. When do you decide whether I should give 1 or 2? Within 3 years. If the pregnancy occurs within 3 years, and complete 2 dose was received in the last pregnancy, then you give only the booster, 1 dose only. Right, so give only 1 dose if it is within 3 years and the complete dose was received. Mission Indradhanush, remember, basically has 12 diseases. Japanese encephalitis is given in endemic areas. If there is an outbreak and you have a child who is 6 months old, measles का first dose हम कब देते हैं? 9 months. But this is 6 months old child. Will you give a measles vaccine? Yes. Early measles can be given, should be given if it's an outbreak, but then you continue the routine vaccine schedule. Right? That means 9 months वाला miss नहीं करोगे. Give the early if there's an outbreak, but then continue with the routine. What do we give along with measles at 9 months? Vitamin A and Japanese encephalitis. Right? The table gives you all the points that we have learned. Just go through it once when you'll be revising. ठीक है? Vitamin A का कितना dose देते हैं? Total dose कितना है of vitamin A in a child that you are giving till 5 years? Total is 17 lakhs. How is it 17 lakhs? 1 lakh is given when the age is less than 1 year. Less than 1 year, you give 1 lakh unit. So this is given at 9 months along with measles. So it's a single dose, less than 1 year. After that, you give 2 doses per year. That means at an interval of 6 months. So that will make it a total of 8 doses. बाकी जो remaining 4 साल है, 2nd year, 3rd year, 4th year, 5th year. You will give 8 doses, 2 lakh international units each. So that will make how much dosage? 16 lakh. So remember that total is 17 lakh that we give. Less than 1 year, 1 lakh. More than 1 year, 2 lakh. So remember the dosage is given every 6 months, 2 lakh. Okay, this is for vitamin A. And how are you giving this vitamin A here? Vitamin A is also given oral, right? This is given oral. The prophylactic, this is given oral. So that is about your vaccines. How do you give the vaccine and the route and the dosage? Coming to rabies and tetanus prophylaxis. Post-exposure, pre-exposure, re-exposure prophylaxis. So in rabies, in your post-exposure prophylaxis, when do you give vaccine? When do you give immunoglobulin? So remember that no exposure, no protection. Some exposure, some protection. Severe exposure, severe protection. No exposure means the skin is intact. Some exposure means that there is just a scratch. Severe matlab transdermal. So no exposure, intact skin, no protection. That means no vaccine is required. Some exposure, some protection, vaccine only. Severe exposure, severe protection. That means you need to give immunoglobulin. Right? You need to give immunoglobulin. Immunoglobulin, remember that has to be given within some points about immunoglobulin, rabies immunoglobulin. It has to be given within 7 days. It is given only once in lifetime. एक बार दे दिया, next time transdermal bite हुआ तो भी आप immunoglobulin नहीं दोगे. It is given only once in lifetime. There is human immunoglobulin, equine. Of course, which is going to be better? Human, right? Horse से better human का ही रहेगा. So human is better, requires less dose, 20 units. Equine requires 40 units. How do you give the rabies immunoglobulin? Never IV. It's not to be given IV. So how is it given? Local site infiltrate करते हो और बाकी जो बचेगा IM away from the vaccine site. जहां वैक्सीन दिया उसके बाजू में इम्यूनोग्लोबुलिन दोगे वहीं वो कॉम्प्लेक्स बन जाएगा, काम ही नहीं करेगा वैक्सीन, राइट? So you have to give it remaining IM away from the vaccine site. So remember, it's not to be given IV, it is local plus IM. So all these points, basically, they have been asked in your INICET exam. So in your post-exposure prophylaxis, we have 2 regimens, the Thai regimen and the SN regimen. How many doses in Thai? Thai is how many letters? 4. SN is how many letters? 5. So Thai is 4 doses, SN is 5 doses. So how is Thai given? Dermal? Yeah, muscular. Dermal. Remember dermal. D is the 4th alphabet. 4 doses given dermal. And SN is given IM. Whenever you are giving IM, you give the complete vial. For dermal, the dose is 0.1 ml. So on what days do you give the SN and on what days you give the Thai? So you start with 0, 3, 7, 14, 28. 0 से पहले start करोगे, फिर 3 का double, rather than 6, write it 7, 7 का double 14, 14 का double 28. 0, 3, 7, 14, 28. Keep doubling. And in Thai, 4 doses are given. तो कौन सा day नहीं देते हैं? 14. Remember in Thai, the fourth is forgotten. The 4th dose is forgotten. So it is 0, 3, 7, 28. The 4th one is forgotten. Right, so that is about post-exposure prophylaxis. Coming to pre-exposure prophylaxis, and remember that this rabies vaccine which we are giving IM in the SN regimen, it is given in which muscle? Deltoid. Remember, this is not given in the gluteal muscle. It is deltoid muscle. In infants and children, you can give in the thigh, but do not give gluteal. The SN is intramuscular. You give the entire vaccine vial. Pre-exposure prophylaxis, re-exposure prophylaxis. How many doses in pre-exposure? Pre. How many letters in pre? Pre. So it is 3 doses. How many letters in re? 2. So kitne doses? 2. Pre-exposure is 3. Re-exposure is 2. On what days do you give the pre-exposure the 3 doses? 0, 7, 21 या 28. तो जो 5 नंबर लिखे हमने SN में उसका आपको स्टार्ट करना है फर्स्ट से और ऑल्टरनेट करना है. इट इज द ऑल्टरनेट डेज 0, 7, 28 या 21. It is alternate. While re-exposure is given on out of 0, 3, 7, 14, 28, the first 2 numbers, which is 0 and 3. Day 0, day 3. Right? So remember, it's the same concept here that intradermal 0.1 ml, intramuscular entire vaccine vial is what you need to give. Dermal is 0.1, muscular is entire vaccine vial. If the re-exposure is within 3 months, you don't need to do anything, not even the vaccine. Remember that re-exposure within 3 months, nothing needs to be done. Right, so that is about the rabies prophylaxis. Pre-exposure, how many doses? Pre is how many? Pre, on what days? 0, 7, 21 या 28. Re-exposure is 2, 0 and 3. Post-exposure is either 4, 5. 4 में कौन सा डे पे नहीं देता है? 14 पे नहीं देता है. 5 is 0, 3, 7, 14, 28. You will never give it in what muscle? Gluteal muscle. ठीक है? So only when it is a severe category 3 bite, then you give the immunoglobulin, and that too only once in lifetime. Coming to tetanus post-exposure prophylaxis, which was asked in your this year exam as well. So tetanus post-exposure prophylaxis is the person is divided basically into how many groups? There are tetra categories. In tetanus, there are 4 categories. Category A, B, C, D. What is category A? Category A means if the tetanus vaccine was received less than 5 years, 5 to 10 years, more than 10 years. And then there is category D, matlab never immunized or unknown. Unknown is taken as never. Remember that अगर there's a history, the person tells कि पता नहीं मैंने 1 डोज लिया है कि 2 डोज लिया है, but 1 डोज तो मैंने पक्का लिया है. So if there is a history that the tetanus vaccine was received whether 5 years before, 10 years before, कितना भी, you do not need to give a complete course now. ठीक है? Anytime if there is a history कि कभी ना कभी तो मैंने लिया है, so in that case you always have to give a single dose. इसमें आप कंप्लीट कोर्स नहीं दोगे. So that's why अगर कुछ लग जाता है तो हम बोलते हैं कि एक टीटी का डोज ले लो, considering that everybody is immunized, right? So remember that we give a single shot of TT. You do not require that single shot if the vaccination has been completed 5 years before, right? Whether it's a full immunization or a booster dose in the past 5 years. So category A, remember, requires no vaccine. It is only care. In category B and category C, you will have to give a single dose. In category D, complete dose is required only in category D, that is never immunized or unknown. If any time the tetanus vaccine has been received, you will only give a single dose. When do you give immunoglobulin? Only in unclean. Unclean होगा तो ही देंगे immunoglobulin. If it's an unclean wound and there's a history that the immunization is complete, then you give the immunoglobulin only if the duration is more than 10 years. If it's an unclean wound and the person is never immunized, you have to give immunoglobulin in all. So remember that it's only in the unclean wound that you are giving the immunoglobulin, and that too is basically your category C or category D. The last two are unclean, category C and category D only require the immunoglobulin. So this is category C, this is category D, unclean. So remember it as IUCD. IUCD. What is IUCD? Immunoglobulin in unclean, category C, category D. So it's only in the unclean. Immunoglobulin in unclean, category C, category D. What is category C? More than 10 years. What is category D? Never immunized or unknown immunization status. Right, so that is about your tetanus prophylaxis. Coming to NVB-DCP, the vector-borne disease control program. So in vector-borne, you have points about malaria. Right, in malaria, why do we give primaquine? Basically, primaquine acts on what stage? Hypnozoites में act करने वाला सिर्फ primaquine है, and that is how it prevents the relapse. The relapse which occurs in malaria is because of the hypnozoites which are in the liver staying dormant there. Primaquine is the only drug which acts on these hypnozoites. That's why you give primaquine. Which plasmodium you would see the relapse? Vivax and OA. Relapse matlab happening over and over again. You see this over and over again. So remember O and V. Oval and Vivax. Falciparum में relapse नहीं है. Malaria में relapse नहीं है. Treatment of malaria. If it's a plasmodium vivax, chloroquine. For plasmodium vivax, it is chloroquine. For falciparum, it is artesunate, ACT. So remember that falciparum is FA. So you give artesunate based therapy, ACT. When they give you, the patient is from Assam, northeastern state hai koi. So you need to give their lumifantrin, artesunate based therapy, artemisinin combination therapy, and you give here lumifantrin. अगर बाकी स्टेट है तो वहां lumifantrin की जगह क्या देते हैं? Sulfadoxine, pyrimethamine, the SP. So remember that in northeastern state, NE is ME. What do you give here? Lumifantrin. In northeastern, it is lumifantrin. Rest of the states is SP. Can you give this ACT therapy in pregnancy, first trimester? Is it given in first trimester? No. Pregnancy first trimester, ACT is contraindicated. So what will you give instead of the ACT? Quinine. Right. So plasmodium falciparum, pregnant female hai, first trimester hai. Do not give ACT there. Give quinine. Vivax है तो chloroquine दे सकते. Can you give primaquine in pregnancy? No. Remember, pregnancy, primaquine is contraindicated. Pregnancy, primaquine is contraindicated. PRI, प्रेगनेंसी में primaquine is inhibited. Do not give primaquine in pregnancy. What is the side effect? Side effect with the quinine? Synchronism. That's one history that will be given. Synchronism is a side effect. Tinnitus वगैरह history रहेगी with quinine. For Vivax, we use chloroquine. Chemoprophylaxis of malaria, short term, long term. Short term मतलब less than 6 weeks. Long मतलब more than 6 weeks. Short term prophylaxis के लिए doxycycline. More than 6 weeks के लिए mefloquine. Remember short पहले आता है first वाला पहला अल्फाबेट D, फिर आएगा M. Short is doxy. This is mefloquine. So if you need for less than 6 weeks, give doxy. For more than 6 weeks, it is mefloquine. Kala azar treatment. The drug of choice for Kala azar, the visceral leishmaniasis, is LAM, liposomal amphotericin B. So when you give the liposomal amphotericin B, what is the advantage? What is the advantage of liposomal over the regular amphotericin? Decreased nephrotoxicity. So amphotericin B is nephrotoxic. You give liposomal, the toxicity is less. In filariasis, now the MDA, the mass drug administration, is advised. So what drugs are given for mass drug administration in filariasis? Remember, there are 3 drugs. Remember, filariasis, the mass drug administration is FIDA, F-I-D-A. So filariasis, I-D-A. Ivermectin, DEC, and albendazole. Ivermectin, DEC, and albendazole. Coming to leprosy, talking about the WHO treatment for leprosy, which now says that be it quasi-bacillary leprosy or multibacillary. How many drugs we give? WHO now says it is 3-drug regimen irrespective of whether it is quasi-bacillary or multibacillary. According to WHO, in NLEP it is still 2 drugs for quasi. So WHO has 3 drugs, whether quasi है या multi है. Quasi-bacillary है तो कितने टाइम के लिए देते हैं? 6 months. Multibacillary है तो 12 months. What are the 3 drugs? Rifampicin, clofazimine, and dapsone. Right. So the color coding of the kit, which is used for this MDT, the multi-drug therapy for leprosy. What is for adult, quasi, adult, multi? Remember that these color that you are seeing, the blue color, the brown color, this is used in, remember, in a child. Child is a बाल, बच्चा, तो इसमें BB वाला यूज करेंगे, that is blue, brown. In बच्चा it is blue or brown. ठीक है, blue and brown, spelling wise, dictionary wise, if you see, first is blue, so this is quasi-bacillary, then is brown, which is multibacillary. बाकी जो 2 कलर्स बचेंगे, the red and green or the pink and green. So in adult, पहले आएगा ग्रीन कि पहले आएगा रेड? अल्फाबेटिकली ग्रीन, फिर आएगा रेड. सो quasi-bacillary, multibacillary, green and red. So quasi-bacillary. So if they give you this kit and they ask you कि किस में यूज करते हैं, कौन सी लेप्रेसी के लिए यूज करते हैं, Blue, bacha, brown, bacha. Blue is possibacillary, brown is multibacillary. Green, red, adult, adult. Possy is green, multi is red. What is this logo for? NLEP, right? So remember that this lotus wala logo, lotus is leprosy. LL, lotus wala logo is for leprosy. What is the mascot हमारा इंडिया में for leprosy? क्या नाम है? क्या नाम है? सपना. Remember sapna. Question आएगा कि sapna is basically related to leprosy. So remember it as leprosy, स्पर्श, है ना? leprosy, स्पर्श छूने से नहीं फैलता है, but this is what was taught till now. So remember स्पर्श वाला is sapna, leprosy. और leprosy is निश्चय, निक्षय, निकुष्ट, निकुष्ट. लेप्रेसी को हिंदी में बोलते हैं कुष्ठ रोग, राइट? सो इट इज अ कुष्ठ रोग, निकुष्ट. व्हाट इज निक्षय फॉर? टीबी. एंड व्हाट इज निश्चय फॉर? प्रेगनेंसी किट, राइट? निक्षय. टीबी को हिंदी में बोलते हैं क्षय रोग. सो दिस इज टीबी एंड निश्चय इज प्रेगनेंसी. In leprosy, this one is lepromatous leprosy or tuberculoid leprosy. If you're given this image and you're asked, lepromatous है कि tuberculoid है? Yes? Options दो ही है. Lepromatous है कि tuberculoid है? क्या दिख रहा है यहाँ? Lepromatous. Why? What is this zone called as? Grange zone. What is the Grange zone? The spared area where you are not seeing these foamy cells, it is a Grange zone. What are you seeing here? White is the foam. कहाँ देखा था foam? Lysosomal foam cells. Niemann-Pick's. What else was there in Niemann-Pick's? Zebra bodies. What was the enzyme deficient? Sphingomyelin. Is there a cherry red spot? Yes. Is there a hepatosplenomegaly? Pick is big, right? So Niemann-Pick is big. Okay, so Grange zone and foamy macrophages are the features of lepromatous leprosy. So remember, this Grange zone is like a fence zone. It's like a fence. अगर कहीं zoo में जा रहे हो, one leopard है, lepromatous leopard है, you will of course need a fence there. So remember that leopard, lepromacy, lepromatous needs a fence. That is a Grange zone, right? The fence and the foam is lepromatous. While in tuberculoid, you can see that the cells are reaching till the epidermis. There is no Grange zone and there is going to be granuloma. Granuloma, किसमें दिखता है granuloma? TB. तो कौन से leprosy में होगा? Tuberculoid. Right, so for granuloma formation, the epithelioid cells, the modified macrophages, giant cells, lymphocytes are important. In NTEP, the diagnostic one, when do you call it a microbiologically confirmed TB? Whenever the sputum is positive. Sputum positive मतलब हमको दिख रहा है उसमें AFB, मतलब ये microbiologically confirmed है. So of course you'll have to start the treatment here. Even if the chest X-ray is negative. If it is sputum positive, you start the treatment, it's a confirmed case. If the sputum is negative, chest X-ray positive, chest X-ray negative. Sputum अगर negative है तो क्या करोगे? TB NAT. Cartridge-based nucleic acid amplification test. So if it is sputum negative, you have CB-NAT. If a HIV positive patient, you are suspecting TB, has hemoptysis, fever, weight loss, then what is the first test you will do here? Directly CB-NAT. क्योंकि in HIV positive, the chances of sputum being positive is very less. So directly you will do TB naught, a recently asked question. So HIV positive में TB है, तो directly do a CB naught. The treatment of TB now is based on how do you decide what drugs do I need to give in a patient. It is based on, the treatment is based on drug susceptibility, the drug resistance. It is now not based on कि ये failed treatment है, कि relapse case है, कि क्या है. Now it is based on drug susceptibility, drug resistance. What is the first drug that you are always worried about the resistance to in TB? Rifampicin. Right, so when you do a CB naught, basically the first drug for resistance that you are checking for is rifampicin. MDR TB is resistant to H and R, isoniazid, rifampicin. While extensively drug resistance is MDR plus resistance to the second line drug as well. In TB, pharmacology yesterday, one more point that you can write down here, bedaquiline. Bedaquiline is used for TB treatment. What is the mechanism of action? Inhibits the ATP synthesis. And what is the side effect? Bedaquiline, Q, it is QT prolongation. So previous question, QT prolongation is seen with which TB drug? Bedaquiline. So the BPAL regimen, it is not yet implemented in India. It is in experimental phases yet. Coming to demography cycle, how many stages in demography cycle? 5. Right, it is 5 stages. What is that stage where you have a negative demographic gap? Stage 5. Right, so remember that in demographic cycle, you have 5 stages. And here also remember the rule of 5. और क्या देखा था rule of 5? Lepra reaction. और कहीं? Malampatti. Right? And here also you have the rule of 5, which is stage 1, stage 4, stage 2, stage 3. So the stage 1 and stage 4 are basically what stages? Stationary. Stage 2 and 3 are expanding. So remember this diagram of demographic cycle. When you are starting this graph, what are you starting with? Straight line. So that means it is stationary. How is the graph going? नीचे से ऊपर कि ऊपर से नीचे? ऊपर से नीचे. So the first one, that is stage 1, is high stationary, low stationary. High stationary. Stage 5 is low stationary. So remember that stage 1 here is high stationary and stage 4 is low stationary. Stage 2 is early expanding, late expanding. 2 पहले आ रहा है ना, early. So it is early expanding. Stage 3 is late expanding. When does the death rate start decreasing and when does the birth rate start decreasing? What decreases first? The death rate or the birth rate? Death rate. Birth rate ka graph you can see it is same like this, while the death rate is decreasing in stage 2 itself. And the birth rate is decreasing in stage 3. Right? It is decreasing in stage 3. So other point to be remembered, decrease in death rate and in birth rate. Starts in what stages? Death rate decrease starts in second. Remember, death, D, die, second. Birth rate, RTH, THR, it is stage 3. So birth rate starts to decrease in second, D, die. Birth rate is stage 3, death rate is 2. 3 and death rate is stage 2. So death rate decreases first, birth rate decreases later. Next one, where is the demographic gap the maximum? Demographic gap, the gap that you are seeing between the birth rate and the death rate. When is the demographic gap the maximum? Stage 2, late stage 2. And the contraction is basically starting in stage 3. So remember that contraction starts in stage 3 when the, what is decreasing? What is decreasing in stage 3? Birth rate. When the birth rate starts to decrease, the contraction also starts. In late stage 2, the birth rate is still the same, like stationary, but what has happened to the death rate? It has decreased. So contraction starts when the birth rate is decreasing, that is stage 3. Demographic gap is negative in stage 5. What do you mean by negative demographic gap? Negative matlab the population is going into minus. That is, birth rate is less or more than death rate? Less than the death rate. Negative matlab the outgoing is more than the incoming. So the death is more than the birth rate. So this is the stage 5 where you see that the birth rate is actually going below the death rate. In stage 5, the birth rate is less than the death rate. So that is what is called as what stage? Declining. And now become over. So high stationary, low stationary 1 plus 4, early expanding, late expanding, and 5 is declining. Remember, here is the rule of 5 and then is the declining stage 5. Okay, that is about the demographic cycle. And India is in what stage? India is stage 3. That is what stage? What stage? 3 is late expanding. Late expanding. Where the birth rate is more or the death rate is more? Birth rate is more हर phases में except the stage 5. Right? But the birth rate has started to decrease. So that's the demography cycle. Coming to fertility indicators. So in fertility indicator, what is the indicator of the complete family size? Complete. Matlab total. So remember it is total fertility rate. Complete matlab total fertility rate. What indicator is mortality dependent? It takes into consideration the children dying as well. So remember mortality, matlab it's a loss which is happening. So whenever we are doing a business and we are looking at net profit, what are we subtracting to get the net profit? Loss. So remember that it's the net reproductive rate. Net matlab subtracting the loss. That is mortality. Most sensitive indicator of family planning achievement services. Family planning is NRR, the net reproductive rate. For a population to stabilize, how much should be the TFR? How much should be the NRR? Population stabilizing matlab हम दो हमारे दो. Okay, there's mother and father. There are two kids replacing the mother and the father. So it's stabilized. दो लोगों ने दो लोगों को birth दिया. So it's a stabilized one. So TFR basically, remember, is total number of children. Okay, total number of children a woman would give birth to. So that is, agar hum do, hamare do. So then the population is stabilized. If TFR is 2, what is the NRR? 1. Remember, NRR is half of TFR. Considering that out of the 2, the 1 is dying, that is net. So TFR is half, NRR is half of TFR. If TFR is 2, NRR is 1. So, and TFR 2.1, NRR 1, the couple protection rate should be more than 60%. CPR, the couple protection rate should be more than 60%. What is that fertility indicator which tells you that the total number of girls a woman would give birth to? We're not talking about the total number of children, total number of girls. That is gross. Remember, total number of children is TFR. Total number of girls is GRR, the gross reproduction rate. Girls wala is GRR. Total children is TFR. Mortality dependent is NRR. Food adulteration. Right, so you have laterism, epidemic dropsy, endemic ascites. छोटा सा table लगता है, but it's confusing. Right, so very important to remember. Laterism, epidemic dropsy, endemic ascites. What is laterism due to? Kesari dal. What is the toxin there? BOAA. Okay, it is BOAA. So remember that for laterism, in humans, what laterism do we see? Neurolaterism. So there will be neurological features, which is spastic paralysis. Right, you have the various stages, the stick stage and all of that. If you're given an image-based question, person walking with the sticks, remember they're talking about neurolaterism. The toxin is the BOAA, the adulterant kesari dal, which is Lathyrus sativus. So remember it as tal, dal, bal. What is tal, dal, bal? Tal basically is tal, LAT, Lathyrism. Is seen with dal, kesari dal. What is the toxin? Bal, BOAA. So it is tal, dal, bal. Lathyrism, dal and bal is BOAA. What vitamin do you supplement to prevent this? Vitamin C, right? Recent exam question. Vitamin C is for prophylaxis. Vitamin C. Next is epidemic dropsy. Epidemic dropsy is, when the epidemic is about to arrive, we will tell everybody, stay alert, epidemic is arriving. Right? So stay alert, epidemic is arriving. What is stay alert? Stay alert is the toxin sanguinarin. Epidemic is epidemic dropsy. Arriving is Argemon. It is Argemon mexicana. Right? Argemon mexicana. So arriving in Mexico, remember it is contaminating the mustard oil. Mustard oil, Argemon oil contaminating the mustard oil. So mustard oil wala rahega history. Remember it's Mexicana, arriving Argemon. What do you mean by dropsy? Dropsy matlab? Dropsy. Dropsy basically means edema. Dropsy matlab edema. So remember there is edema everywhere. Lower limb edema. Cardiac failure hoga uske wajah se. And there is edema in the eye as well. What is the edema in the eye? Glaucoma. Increased water in the eye, that is glaucoma. So if glaucoma is given, remember basically it's edema, it is dropsy. Endemic ascites, remember it as fasciitis. What is fasciitis? The toxin. What is the toxin? Pyrrolizidin. Ascites कब दिखता है? Ascites, most common cirrhosis, right? So basically affecting the liver. So this is hepatotoxic. So the features you would see is ascites and jaundice. It is hepatotoxic. And what is the adulterant here? The crotolaria seeds, which is called junjunia. Crotolaria. So remember it like liver cirrhosis, crotolaria. Liver wala karega cirrhosis, crotolaria. Now, how do you identify the image? Is it important to know? Yes, because INICT had an image-based question and this image was given. So you are asked to identify this. So this one which you are seeing, it is a flower that you are seeing. Remember, if you see this yellow color flower, it is argemon. Argemon causes क्या है? Laterism, dropsy, ascites. Dropsy, arriving epidemic. Stay alert. What is the toxin? Sanguinarin. Right? Dropsy is edema, pani everywhere. This one is crotolaria. Right? This is crotolaria, where you would see these seeds like C-shaped. Crotolaria. Crotolaria. You will see the crop and you will see the C-shaped seeds. So if you look at the plant of crotolaria, so remember like it has this pod-like feature, crop or pod-like feature that you would see. It is not just a yellow flower like this. If it's a flower, it is argemon. Yellow color with this crop or pod from which these seeds basically will come out is the crotolaria. And kesari dal, right? So this is dal contaminated with the kesari dal. So laterism, this is argemon, and this one is going to be crotolaria. This is crotolaria. Right, so summary table here. Kesari dal, what is the toxin? BAL, BOAA, what does it cause? Laterism, neurolaterism. Mustard oil, Argemon mexicana, stay alert, epidemic is arriving. Next one, millet wala, basically endemic ascites, that is fasciitis. It will have ascites and jaundice as the features. Crotolaria. Crotolaria is the adulterant. Groundnut wala agar history rahega, very important. It is basically talking about aflatoxin. Groundnut is aflatoxin. What does afla stand for? Aspergillus flavus. And it's a hepatotoxic. What cancer? HCC. Jawar bajra eating wala history rahega, talking about ergotism, the claviceps purpura. Ergot we know causes vasoconstriction. By causing vasoconstriction, it can lead to gangrene. Because it is a vasoconstrictor, remember ergot is used in the treatment of migraine. It's used in the treatment of migraine. Coming to RDA, recommended dietary allowance versus EAR. What is EAR? What is EAR? Estimated average requirement. This was asked in your this year NEET PG 23 exam. Estimated average requirement versus RDA. What is the difference? Estimated average requirement is meeting the requirement in average. Average matlab is 50%. Versus RDA is 90%. So average is 50%. That's how you will basically guess there. Average is 50%. Now what is the RDA calories in a sedentary female, a moderate working female, and a heavy work female? So remember that sedentary female, sedentary, you start with 1700. Approximately 1700. जैसे जैसे काम बढ़ेगा, requirement बढ़ेगा, so we will have 17 plus 4 plus 6. 17 plus 4, 21. 21 plus 6, 27. So plus 4 plus 6. जो हमारा मॉडरेट फीमेल का एक रिक्वायरमेंट है वो सेडेंटरी मेल का रिक्वायरमेंट है. जो हेवी फीमेल का है वो मॉडरेट मेल का है, राइट? सो दिस इज 21, 21, 27, 27. And what is for heavy male now? It is the double of the sedentary female, 34. So this is how you'll remember. It is 17, 21, 27, and this is 3400, which is double the 70. What is a reference man and a reference woman? Even question is asked on that. The age is 19 to 39. BMI is 18 to 22. Weight of a reference female is 55. And a reference male is more than female, 65. 10 kgs more. Right? So do you fall in this category of reference men and women? No? 19 to 39? I'm sure all of us are there. 18 to 22? देखना पड़ेगा. Weight 55. Yes, I fall under this category. Yeah, so weight is 55. Age is 19 to 39. I'm less than 39 for sure. Okay? So that is the reference man and woman. Additional calories. How many additional calories do you require in pregnancy? If I ask you that in which trimester no additional calories are required? First trimester. इसमें no additional calories are required क्योंकि यहाँ पे first trimester what is happening is organogenesis. The fetus is like not growing, taking up the weight. Maximum जो growth होता है कब होता है? Third trimester. So that is when you need the maximum additional calories, like around 450. Pregnancy, if you have to choose one number कि कितना additional calories है, average 350. Lactation में उससे ज़्यादा 520. First 6 months is even more, which is 600. Because first 6 months exclusive breastfeeding, it is more. What vitamin you need to supplement with breastfeed? DK. Right, that's about the RD. Coming to water. Water purification. Bleaching powder, chlorine use करते हैं. Right, chlorine. What is the disinfecting property of chlorine due to? Hypochlorous acid and hypochlorite also. But if the question is कि maximum किसकी वजह से है? It is hypochlorous. Major is hypochlorous. How do I know the chlorine demand of the water? What helps me to measure that? Horrocks apparatus. Right, the Horrocks apparatus where you will see these multiple jars like this. This is for chlorine demand. What do we use here? Starch iodide. ठीक है, starch iodide. It helps us to determine कि chlorine demand कितना है. ये पानी को purify करने के लिए कितना chlorine लगेगा. And what is the use of chloroscope? What is chloroscope for? Residual chlorine. So understand the difference. Horrocks apparatus is for requirement, that is the chlorine demand, and chloroscope is scope मतलब देखना. So remember that you are looking at the chlorine which is present in the water now, that is residual chlorine. Right, so chloroscope is looking at the residual chlorine. Horrocks is for requirement, the chlorine demand. So in the residual chlorine, when I want to measure the residual chlorine, It can be in the free form or the combined form. The test which helps me to identify both, measure both separately. I can measure the free separate, residual separate is what test? OTA test. Not just OT, it is OTA. Remember OTA, A for all separately. The A, when you add it, it helps you to measure all separately. So it is free and combined separate. So the color which is produced when I'm measuring the residual chlorine, the yellow color which is produced in the first 15 to 20, 10 to 15 seconds, it is because of the free chlorine. So remember that free chlorine comes first. First color change in the first 10 to 15 seconds is because of the free chlorine. How much residual chlorine is required in drinking water, in swimming pool and for guinea worm? कितना residual chlorine होना चाहिए? So remember it as 0.5, 1 and 2. You are doubling it. 0.5, 1 and 2. So 0.5 you are starting with drinking. So imagine you are drinking water. Then you are diving into the swimming pool. And when you dive into the swimming pool, what do you see in the swimming pool? Guinea worms. Remember, start with drinking. Drink, swim and the guinea. So 0.5, 1, 2. Disaster के टाइम पे कितना होना चाहिए? 0.7. Disaster SS is 7.7. And how do I measure the residual chlorine? Is by fluoroscope. This is for residual chlorine. Bacteriological surveillance. What bacteria helps you to identify whether there's a fecal contamination, recent contamination, remote contamination? The most reliable and efficient indicator for fecal contamination of water is E. coli. Remember, fecal, EC is E. coli. Fecal is E. coli. Remote is Clostridium perfringens. जो एकदम परे परे मतलब दूर, away, that is remote. Perfringens is pare, that is dur, away, remote contamination. Recent contamination, I write recent as S to remember it is streptococcus. Remember recent strepto, remote pare, perfringens, fecal, E. coli. The disinfecting property of bleaching powder is because of chlorine, and that is maximum hypochlorous acid. We have seen this: fecal, E. coli, recent strepto, remote pare, perfringens. Right, so that's about water. Coming to air. What are the air pollution indicators? So they ask you the question, soiling index is an index for air pollution, water pollution, noise pollution. Remember, this is for air pollution. So grit index, soiling index, this is basically for air pollution. Remember it as air. Air matlab gas. So grit, air, soiling. Grit index, soiling index is air. So grit, air, soiling. The most important air pollution indicator is sulfur dioxide. The biological indicator of air pollution is lichens. For air quality index, the AQI, when is it called a good air quality index? When it is 0 to 50. What instrument is used for cooling power of air, humidity of air, air velocity? Remember, for cooling power of the air, कौन सा use करते हैं? Kata thermometer. So remember that Kata thermometer is for cooling. Kata is cooling, and cooling, OLLO, it is also for the low air velocity. So Kata thermometer is for cooling power and the low air velocity. How do I identify which is Kata thermometer, which is globe thermometer? From the image based questions if I get. Remember Kata thermometer. अगर किसी ने काटा, कुत्ते ने काटा, किसी ने काटा, क्या आएगा वहां पे? Blood आएगा. So if you see this red mark, it is Kata. While if you see something like a globe, goal like a globe like this, earth के जैसा गोल, it is going to be a globe thermometer. Globe is goal. And what does a globe thermometer measure? Radiant heat. Right, so remember that radiant heat temperature or the corrected effective temperature is by the globe. Globe is goal. What do you use for measuring the humidity? H for H. Humidity is hygrometer and uska rhyming psychrometer. For humidity, it is hygro and psychro. So sling psychrometer, Aspen psychrometer, dry and wet bulb hygrometer, all of this is for humidity. So if you are given an image like this, many times the image itself has the answer. What is this used for? Humidity. लिखा है वहां पे. This is for humidity. Okay? So this is a hygrometer. Right? So it actually happens. NEET PG में भी हुआ है, I9CT में भी हुआ है. The examiner forgets to remove this. So always try to look for the hints in the image, provided the image quality is good. Right? So it is humidity hygrometer. This is a sling psychrometer. Right? So ऐसे जो गोल गोल घूमेगा, that's a sling. So this is a sling psychrometer which will be used for humidity. Hygro, psychro, humidity. It's a sling psychrometer. Right. So PSM हो गया बहुत ज्यादा? Yes. Complete करना है? Right. So how many of you like, let's complete the PSM part? Chalo, great. So let's try to complete this. Biomedical waste. Biomedical waste जितना difficult लगता है उतना difficult है नहीं. So we have the yellow, red, white, blue. So for yellow, again what you need to remember is yellow, dirty fellow. So all the dirty thing, infectious, blood wala, this goes into yellow. So the points to be remembered for yellow is yellow, dirty fellow. Other thing, start hierarchically. You start with the human. Human के नीचे आते हैं animals. Animals के नीचे आते हैं microbes. Right? So be it human waste, animal waste, microbiological waste. All this will go into yellow. So yellow, dirty fellow. The dirty fellow can be human, animal, microbe. So when I say it's a human waste, basically the fetus, placenta, organ, tissues, all this will go into yellow. Microbiological, the culture plates. Next you have is, the next for the yellow to be remembered is LIC. What is LIC? Liquid waste, life insurance. LIC is liquid, infectious and chemical. Liquid, infectious, chemical. Remember, LIC is dirty fellow, yellow. So, liquid. All the liquids, the body fluids, basically will go into yellow. So, the body secretions, the body fluids, sputum, pus, pieces, the X-ray developer fluids, disinfectants, ये सब जो liquid है, this is yellow. Right? So, plural tap किया, plural fluid है, yellow. Infectious, आपका microbiological stuff, and the chemical waste also. So that is chemical cytotoxic waste goes into yellow. So medicine, cytotoxic, that goes into yellow. So expired, discarded medicine, cytotoxic waste, the secretions, all of this is yellow. Blood bag goes into yellow and urine bag goes into red. Blood is red in color, red in yellow, yellow in red. The uro bag contains the yellow urine, it goes into red. The blood bag contains the red blood, it goes into yellow. Remember, red in yellow, yellow in red. Right? Important. Blood bag is yellow, uro bag is red. So live vaccine vial, which is microbiological. The mask, head cover, shoe cover, this goes into yellow. तो जो भी ये क्लॉथ वाला भी रिलेटेड है, the linens, the beddings, the mattresses, gowns, mask, shoe cover, head cover, all this is yellow. So remember that for C you can remember chemical, cytotoxic and the clothes wala. Red, what is for red? Red is recyclable. Remember red for RE, recyclable. What recyclable? Rubber, RRR. Red recyclable rubber and plastic. Rubber plastic is red. So plastics, syringes without the needle, syringes plastic, Euro bag, yellow in red, rice tube, IV drip, and your face shields, goggles. Face shield, goggle. Remember, like this is plastic. This will go in red. White में क्या जाता है? Sharps. Remember, it is white, sharp, sharp like the white teeth. Sharp like the white teeth. So white is sharp teeth. So needles. Blue में फिर क्या जाएगा? Glass. Blue is like glue, that is glass and metal. Glass and metal. So glass and metal is blue. So pacemaker, orthopedic implants, glassware, this will go into blue. Right, so looking at this table, blood bag is yellow. Red and yellow, Euro bag is red. Right, remember red and yellow, yellow and red. Gloves. Gloves किस में जाएंगे? Red, because they are made up of rubber. Right, so remember gloves, rubber, red. कोई भी gloves हो, red में जाएंगे. Cytotoxic drugs, LIC, yellow. Syringes, plastic, red. Needle sharp, white. Body fluid, yellow. LIC, liquid. Metal, blue. Glass, blue. IV tubing, red. Right? It's rubber. So it is recyclable, red. Syringes with fixed needle. Sharp है तो white में जाए. ठीक है? So that's all you need to remember. Yellow is dirty fellow, human animal microbe, LIC. Red recyclable rubber plastic, white sharp teeth, and it is blue is glass and metal. So in LIC, remember the C is the chemical, cytotoxic, and also the cloths. For the yellow bag, incineration is done for yellow. Remember, this is frequently asked, incineration is done for yellow. The prophylactic vaccines we need to give here is hepatitis B and tetanus. Coming to disaster management. Disaster management comes under the Ministry of, what's the ministry? Sorry? Home Affairs. Right, this has actually been asked in one of the previous exams. Now in disaster management, what do we do before the disaster? Mitigation and preparedness. After the disaster is the response and rehabilitation. So what is the difference between disaster mitigation and disaster preparedness? What is mitigation and what is preparedness? Mitigation, alphabetically JKLM. The legal measures is the mitigation. Right? Like the legal measures being making a building earthquake resistant, fire safety, ये सब होना चाहिए. This is legal. So it is mitigation. Preparedness, P for power. What power? Manpower. So at least remember, like getting the manpower ready, giving them all the skills, like a mock drill. So that is your preparedness. So remember that the planning and the legal measures to make the community safe and decrease the impact of disaster is mitigation, like building the earthquake resistant buildings. Gathering the resources like the manpower, money, material, technical skills, which may be required during the disaster is preparedness. Power. Preparedness is manpower. So example will be mock drills. What is the most common disease during the disaster phase? The gastroenteritis, GI. And what is the most common vitamin deficiency? Vitamin A. Most common long-term sequelae of disaster is malnutrition. Okay, khana pina is affected, malnutrition. Zoonotic disease after floods, water, rain, that is leptospirosis. Remember leptospirosis? Rat wala. What are the 3 R's for leptospirosis? Rat, rain and rice field. Right, so pani mein, it is leptospirosis. All vaccines are contraindicated in post-disaster phase except measles needs to be given in 3 days. The vaccine for the healthcare workers, disaster response team working in the endemic zones, what vaccines are given? Typhoid, hepatitis B and cholera. So remember that to healthcare, what vaccine we give is to healthcare? Typhoid, hepatitis B and cholera. ये tetanus नहीं है. T is for typhoid, not tetanus. जो बायोमेडिकल वेस्ट में है क्योंकि वहां शार्प वगैरह है वहां पे टेटनस है. ठीक है, दिस इज टाइफॉइड, हेपेटाइटिस बी एंड कॉलेरा. Coming to triage. Triage basically means prioritizing. So if there is some disaster, like there is a railway accident, there's something, you prioritize ki out of the calamities that have occurred, which person should receive the treatment on priority. So basically it is prioritizing the treatment. The highest priority is what color coding? Red. Right, so remember that the priority goes like a traffic signal. Highest priority is red, then is yellow, then is green. और सबसे नीचे आता है black. Black is the least priority, red is the highest priority. तो सबसे ऊपर red, yellow, green. So when it's the red, the highest priority, basically you need to do intervention within 0 to 6 hours because this intervention can be actually life-saving for the patient. The disorder, like example which comes here is pneumothorax, airway obstruction, cardiac arrest, ऐसा कुछ है. Where you intervene, you can save the life. It's highest priority. Next is yellow, 6 to 24 आवर्स में इंटरवेंशन करना पड़ेगा. ग्रीन मतलब एम्बुलेटरी. एम्बुलेटरी पेशेंट को कुछ ज्यादा हुआ नहीं है, दैट मीन्स इनको आप छोड़ सकते हो. सो इट इज एम्बुलेटरी इज ग्रीन, go, good to go. So green light in the traffic signal tells you that you can go ahead, ambulatory. And black का मतलब moribund or dead. That means you're not going to save a life here. It's already a dead person. So this is going to be the least priority. So remember, the least is black, not the green. Right, so that's about the triage. You have these disorders which are given here, like tension pneumothorax, airway obstruction, cardiac tamponade. All of this is high priority. Minor lacerations, which is ambulatory, is green. Okay, ambulatory is green. Coming to pneumoconiosis. Right, pneumoconiosis, occupational lung disease because of the dust particles which can be inorganic and can be organic. Inorganic मतलब silicosis, asbestosis. Organic मतलब जो organic material है जैसे sugar cane, paper, this is organic. So bicyanosis, bagasus. The size which is dangerous size here for the particles. What particle size is dangerous? 0.5 to 3 micron. 0.5 to 3. The most common pneumoconiosis and which is the most common cause of mortality and permanent disability also is silicosis. It is overall the most common for everything. Most common disability, most common mortality. Silicosis. This was asked in a recent exam. Silicosis is something which is associated with TB. You have this term which is called as silicotuberculosis. So logically thinking, silicosis will affect upper lobe or lower lobe of the lung. Upper lobe. TB क्या होता है? Upper lobe. So remember, it is the upper lobe. On the other hand, what affects the lower lobe? Asbestosis. Remember, asbestosis is affecting the base of the lung, which is the lower lobe. Again, a previous INICT exam question. Asbest affects the base, the lower lobe. Silicosis, asbestosis. What appearance you see on chest X-ray? Silicosis, S for S is the snowstorm appearance. Asbestosis is ground glass. Remember, asbestosis is ground glass. In the occupation, you can also have this glass industry working person. Remember, ground glass working is asbestos. So remember, in ground glass, the AS is asbestosis. It is asbestos. Silicosis is snowstorm. So in asbestosis, the history will be of glass, cement, fireproof textiles, and also the shipyard. In coal miners, what disease do you see? Anthracosis in coal. Anthracosis. Right, because of coal, the black, you would see the black deposits in the lung. Bicyanosis is because of textile. Remember, bicyanosis is textile meat. You can remember this as a cloth material आता है which is called as bicylisi. है ना, bicylisi material. So remember, bicylisi is textile. It's a type of textile. Bicy is textile. Sugarcane waste will be bagasosis. Remember, sugarcane, GA is bagasosis. And also the other history is cardboard or paper industry. So remember that cardboard. है ना, जो कार्डबोर्ड, राइटिंग पैड, कार्डबोर्ड बोलते थे हम उसको बचपन में, कार्डबोर्ड और राइटिंग पैड इन द बैग. So students can carry the cardboard in the bag, that is bagasources. अगर नहीं कैरी किया, right? So if someone forgets the cardboard, carrying the cardboard, remember it's nothing to be worried about. You don't need to notify about that. So which is the non-notifiable? Bagasources. So bagasources is non-notifiable. What is this X-ray showing? What is this? What is the white on X-ray? Calcification. White is the calcification. So this is showing the calcified pleural plaques. White is the calcification over the pleura, the calcified pleural plaques. If you look at the chest X-ray, you would see some white irregular lines like this. All these are calcified pleural plaques, which are seen in asbestosis. What bodies you see in asbestosis? Ferruginous bodies. What is the appearance? Dumble. If it is ferruginous iron, what stain can you use for this? Prussian blue, pearl stain, Prussian blue, pearl stain. Ferruginous is dumble shaped. So these are basically the dumble shaped ferruginous bodies. And what tumor is specific in asbestosis? Mesothelioma. What is a mesothelium basically? The lining of the pleura. So remember that mesothelioma, pleural lining, pleural plaques, that is what you see in asbestosis. This mesothelioma can come many years after also. What is the tumor marker for mesothelioma? Calretinin. Right, remember calcified pleural plaques, calretinin tumor marker. So calretinin positive is basically mesothelioma. So that is pneumoconiosis. Going to the last part in PSM, that is the biostats part. Right. So talking about the various graphs, how do you identify it's a bar, it's a histo? So a bar diagram, a bar graph or a bar diagram is basically used for qualitative data or quantitative data. Quality. It is qualitative data. First of all, understand that how do I know it's a qualitative data or a quantitative? Height is qualitative or quantitative? T or L? Because one of same T, quantitative. Sex, gender, quality, quantity. Quality, right? It's a quality. Blood pressure, quality, quantity. Quantity. So what is quantitative data basically? Which is quantified, which is measured. And it has units. Like height, 100 centimeter. Blood pressure, millimeters of mercury. It is something which can be measured and it has units. Qualitative data is like nominal data or categorical data. You either categorize into male, female, right? Or it's just the naming. It's not measuring. So quantitative data is also called as continuous variable. Continuous basically is quantitative. And for that we use histo. Histogram is for quantitative. Bar is for qualitative. The qualitative data is called as discrete. and it is discrete, male and female. It is a discrete variable. So discrete variable basically means qualitative variable. So in a bar, it is used for discrete variable. The graph also is discrete, matlab separate. So this is separate from this. They are not connected to each other, right? It is not continuous. There is a gap. A discrete gap is present. So if you see this discrete gap present, it is a bar graph. Okay, it's a bar. So कितने लोगों का कौन सा favorite type of movie है? Comedy, action, romance. That's basically the bar, qualitative data. If the graph is continuous like this, are you seeing any gap? No. One bar is touching the other bar. No gap basically means continuous graph, and this is going to be histo. A graph which tells me the trend of a disease over time. ना जैसे कोविड में हो रहा था, कितने केसेस आज है, कितने केसेस कल हैं, कितने नेक्स्ट है. Trend over time is given by line diagram. It's a line which tells me that how's the trend, whether it's rising or it is falling. Line is for time, trend over time. This looks like a pizza with a pie, pizza pie. So this is like a pizza pie. This is a pie chart. This is a pie chart. And in pie chart, pizza pie percentage, the data is represented as a percentage. It is not the absolute value. Pizza pie percentage. It's going to be a circle. This one, when you have overlapping circles, this is called as Venn diagram. Venn is overlap. Remember, Venn is where you have the overlap present. For overlapping properties, it is Venn. Overlap is Venn. This one is क्या ये? Pie chart. I can show you two images of pie chart. Right? एक बार हो गया तो दूसरी बार भी आ सकता है. It is a percentage. It's a circle. Circle with percentage, pizza pie. What is this? Bar. Why is it a bar? Discrete gap present. What is this? Bar or histo? Bar. There's a gap which is present. So again, it's a bar diagram itself. What is this? Bar. Okay, again, it's a bar. One bar is having multiple components. So component bar diagram. This is histo. How is the bar? Continuous. Right? It is continuous with histo. What is this? Sorry? What is this? You have two options. Is it a ogive, ogive, whatever you want to call it, or is it a frequency polygon? Frequency polygon. Why not an ogive? What do you measure in an ogive? It is cumulative frequency. Cumulative frequency matlab you add the previous two frequencies. So when you add the previous two frequencies, so that let's say the frequencies are 1, 2, 4, 7. So I'm plotting the cumulative frequency. 1, then 1 plus 2, 3, 2 plus 4, 6. So that's how the number will always go on increasing or decreasing. In cumulative, it's always going to be a rising graph because it is cumulative. You are adding. If you are seeing this graph as having a fall, that means it cannot be a cumulative frequency. So this is a frequency polygon. How is a frequency polygon made? Basically by joining the midpoint of histogram. हर बार जो histogram में उसका midpoint join करो. You are joining the midpoint That gives a frequency polygon. While the cumulative frequency is a ogive. Remember, on the y-axis, cumulative frequency will be mentioned. Cumulative frequency. Even if you cannot see this in the graph. Right. Remember that. So just writing it down to make it clear that this is February, this is March. So we are seeing that what was the status in February. We are seeing that what is the status in March. So what is this? February में क्या कैसे rise हो रहा था, March में कैसा status था? What is this? Trend over time. So what will this be? A line diagram. Trend over time. Right? So in the line diagram, you would see this time. It could be a year, it could be a month, it could be a week, anything. What is this called as? It's a box and it has these whiskers. Right? A box with the ears. So it's a box with the whisker. So this is called as box whisker plot. There's a box with a whisker. What is the midpoint in the box indicating? What is the midpoint indicating? Median. The midpoint is the median. So where the box is starting, it is the quartile, the lower quartile. This is the upper quartile. The whisker is telling you that और भी कुछ values है which are outside this box. So the minimum value is where the whisker is starting. The maximum value is where the whisker is ending. So remember that the midpoint of the box is the median. This is a lower quartile, upper quartile. The box can be sleeping box or a standing box. Right? So that is box whisker plot. What is this? Stem and leaf. So you have one stem which has these multiple leaves. Okay, multiple numbers here. In the stem, there is one number and the leaf can have multiple leaves or one leaf. So this is called as stem and leaf. So basically the number is read as 12, 18, 13, 19, 15. So this is 20, 23, 29, 22. Okay, so this is called as stem and leaf. This is like a tree diagram which is branching. A tree going into multiple branches. Right? So that is over the generations. If you want to see something, that is a tree diagram. On the y-axis, if survival is mentioned, survival. What graph do we use for survival probability? Kaplan-Meier. Remember, it is Kaplan-Meier. A Kaplan-Meier graph helps us to see the survival probability. So if this is group 1 and this is group 2, which is shown here, this is group 1 and this is group 2, which is having a higher survival probability? Group 1 or group 2? Group 2. This is the time which is shown. At any particular time, look at the survival probability of this group is like 5, 10. The survival probability of this group is more. So which is having a more survival probability? Group 1. Right? This is group 1. This is group 2. So, if I tell you that a new drug was tried in patients with diabetes mellitus and the new drug is this one, right? The green one is the new drug and this is the current drug. So, is the new drug better? It is rather toxic. What is it doing? It is decreasing the survival. That means it is like more toxic. So toxic drug basically will decrease the survival. A good drug will increase the survival. Right? That is what is the application there. What is this plot called as? Funnel. You know funnel कैसे होता है? Funnel ऐसे होता है triangle. This is ulta funnel. This is a funnel plot. This is a funnel plot. And what is this one called as? Forest plot. funnel and forest. Remember that this funnel and forest plot are used in what studies? Something called as meta-analysis. The funnel plot and forest plot are used in meta-analysis. What is meta-analysis basically? What is meta-analysis? Meta-analysis is, suppose I want to study the association of, let's say, smoking and lung cancer. I look into all the journals, all the published articles in the various journals which are talking about smoking and lung cancer. And then I see that every study, what is the inference? So I'm not doing the experiment myself, but I'm looking at what are the past studies telling me. Okay, and from there we do the analysis. So meta-analysis is like multiple studies ka analysis. It is a multiple studies that have been done in the past that we are analyzing. And that's why you are seeing here in this, you can see that what is mentioned, Smith et al, Jones et al. So कौन सी study ने क्या दिया था result? That is what is indicated here. This is multiple studies being analyzed. And in the forest plot, the lower diamond that you see here is basically showing you the summary. What is the summary that I've got out of all these studies? Right, so in the forest plot, remember that the summary is telling me that this is showing you the odds ratio. Because we are going in the past, it's like a past wala case control, odds ratio aa raha hai. The odds ratio yahan pe is how much? 2 ke aspas. So that means, is it a significant association? Yes or no? Yes. So if the odds ratio is more than 1, basically it is significant. Now the question which is asked here, this is frequently asked in your INICT exams. Out of these studies, if I label these studies as study 1, 2, 3, 4 and 5, these are the 5 studies. Out of these studies, individual studies, which of these shows a significant association? 4 and 5. Why not 1, 2, 3? Right. So if you see here in the study 1, this is the odds ratio and odds ratio. It is more than 1. But the problem here is, look at the line which tells you the confidence interval. If the confidence interval includes 1, confidence interval 1 मतलब ये 1 को touch कर रहा है, 1 मतलब no association, right? There's no association. So if the confidence interval includes 1, remember it is not significant. So very, very important, when you solve the questions, you'll see this. If confidence interval includes 1, if confidence interval includes 1, that means it is not significant, even if the odds ratio is more than 1. So just on the basis of odds ratio, do not say कि significant है कि नहीं है. Right, so here you see that all the studies are giving you the odds ratio more than 1 and the bracket tells you the confidence interval. Is it significant? No, because it includes 1. Is it significant? No. Is this significant? No. 0.9 to 3.2. The 1 is included here. Right? So these are not significant. 1.9 to 2.7, 1.8 to 2.5, they are not including 1. So these are significant. Okay, these are significant. Two things that you have to look at, odds ratio and the confidence interval should not include 1. And what is generally the confidence limit that we take to call it significant? कितना percentage? P value कितना होना चाहिए? P value to call it significant should be less or more? Less. How much is the general one taken? Less than 0.05. It is 95% confidence limit. What is a P value? In simple terms, if I tell you, P value basically is a error. Error कम होना चाहिए कि ज़्यादा होना चाहिए? कम होना चाहिए. It should be less. It should be less than 0.05. The 95%, that is how many standard deviation is 95%? Plus minus 2 standard deviation, right? That's what we take as generally normal, plus minus 2 standard deviation. So 95%, that is 0.05. 100 minus 95, 0.5, that is 0.05. This is something which is very important to understand. Significant p-value and all of that. So forest plot, funnel plot, both of this is for meta-analysis. Funnel plot basically tells me, what is a funnel plot telling me? Funnel plot, if I see that there are multiple dots in one area accumulated, that basically is for publication bias. It's a publication bias. So funnel plot, because you're looking at the multiple publications in the past, remember it is important. It is showing you the publication bias. Right, that's about the various graphs. Very, very important. Going to scatter diagram. Scatter diagram. The term itself tells you how far the dots are scattered is a scatter diagram. So it will show you the dots which can be very close together or which can be scattered like this. So scatter diagram basically is used for relation between two variables. Scatter is for relation. Remember scatter ER, RE is for relation. So this scatter diagram shows me the relation by giving a correlation coefficient. So in which diagram you get the correlation coefficient is a scatter diagram. Relation, correlation, scatter. And remember that this correlation coefficient, that is R, should always be between -1 to +1. The value of R should always be between -1 to +1. If they tell you, these are questions asked in previous aims, a study was done which showed the relation between using magic book and the NEET PG scores, right? And it showed that the R ka value is +2. What is the inference out of this? It's an invalid study because R can never be more than 1. It always has to be -1 to +1. -1 से नीचे नहीं जा सकता, +1 से ऊपर नहीं जा सकता. It's an invalid study. The relation of using the magic book and the NEET PG score should be positive or negative? Positive. What do you mean by positive relation? Positive matlab you increase the use, you increase the scores. Both are going in the same direction. ऐसा नहीं होना चाहिए कि तुम मैजिक बुक शॉर्ट यूज कर रहे हो और स्कोर कम हो रहा है. That's a negative, right? So remember that positive matlab going in the same direction. If one increases, the other also increases. If you are using the MedSynapse app, your GT scores will increase. It's a positive correlation, right? Social media ज़्यादा use करोगे, GT score कम हो जाएगा. So this is what correlation? Negative, मतलब opposite direction. So positive matlab both in going in the same direction. Increase one, the other increases. Increase one, the other decreases is negative. Right? So increased use of social media, decreasing the scores is negative. In the scatter diagram, the dots, if they are very, very scattered, that means that there is no correlation. The lesser the relationship. The more closer the dots, that means they are related, they are going together, the relationship is better. Now from this graph, if they give you this graph and they tell you, is it a positive correlation or negative? Negative. Why? Down going line. Upar se, the line is going downwards. It is going down, that is negative. This one is a upgoing. It is positive. Right? When the x-axis is increasing, y increasing, x decreasing, y decreasing. They are going close upwards. The more scattered the dots, there is no relation. No relation basically is given by r equal to 0. Please do not confuse here with the odds ratio and the relative risk. In odds ratio relative risk, no association is a value of 1. Here it is the relation coefficient का होना चाहिए 0. Right, so the more close the dots are, like you see here, it's forming a single line, the stronger the relation. If the line is going down, it's a negative correlation. As the scattering increases, the relation decreases. So remember that r equal to 0 means no relationship. And one question asked is coefficient of determination. What is the formula for that? R square. Coefficient of determination is r square. One question asked was the relation between infant mortality rate and the socio-economic status of the family will have which of the following R value? What is the answer? लिखा है 0 minus 0.4 लेकिन क्यों? Why the answer is minus 0.4? Infant mortality rate, socio-economic. First decide it is positive or negative. If the socio-economic status is high, good financial condition, the infant mortality rate will be less. So is it positive or negative? Opposite, that means it is negative. So which options do you rule out? Plus, plus. It's not positive. 0 matlab? No relation. There is a relation, right? So that means 0 is out. Why it is not minus 1? Minus 1 matlab perfect. This is the only factor on which it is dependent. This is not just one factor, there are multiple other factors. So even this is ruled out. So the best answer here will be minus 0.4. This is your AIMS exam ka previous question. Right? So you just have to look, it is positive or negative. Right? And it's not a perfect correlation. So minus 1 is out. Coming to test of significance. The chi-square test, the t-test, unpaired and paired. So remember that quantitative data, qualitative data. Quantitative. T, T, T. What test do you use? T-test. So for quantitative, T, 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 it is T. Quantitative matlab having units and can be measured. So for qualitative, it is chi-square. One is chi-square and the other is Fisher. Remember CH, CHI, the chi and the Fisher are qualitative. So C for C, the qualitative data is categorical data, nominal data, right? You categorize, there's just naming and it's qualitative. It means the same. So categorical chi-square, which is qualitative data. When do I use a paired t-test and when do I use an unpaired t-test? So unpaired t-test is used when there are how many groups? 2 groups. So remember that unpaired is made up of like 2 words, unpaired. So how many groups? 2 groups, 2 interventions. So the example of this is, suppose there's a group of people who are hypertensive, right? There is a group of people who are hypertensive. We divide them into 2 groups, group A and group B. In group A, we give drug 1. In group B, we give drug 2. And then after that, after 1 week, we see the blood pressure levels. So the question is, what test you will do in this case? सबसे पहले chi-square use करोगे कि t-test use करोगे? What are we measuring here? Blood pressure. Is it qualitative, quantitative? Quantitative. So what will I use here? T-test. So first you have to decide whether the data is qualitative or quantitative. Quantitative and t-test. Now you have to decide it is two groups, two interventions, or one group, one intervention. We have divided into two groups, group A, group B with drug 1 and drug 2. So what will we do here? Unpaired. Unpaired is two words, two groups, two interventions. If I would have told you that this group of hypertensive, you give a drug and then you measure blood pressure after 1 week. So it's a one group, one intervention. So basically you are measuring the blood pressure before and after the intervention. So this will be what test? Paired. Remember, paired is a single word. So one group, one intervention. Before and after. In single group, single intervention. And in the quantitative, if they tell you that instead of the two groups, we have divided the subsample into three groups, four groups, then what test will you do? ANOVA. If it is more than two groups, quantitative data, then you will use the ANOVA. ANOVA is when you have variable, more than two variable groups. ANOVA is variable. So it is more variable, there are more than two groups. What test will you do to see that how much proportion or percentage of smokers are getting lung cancer? Or what is the association of smoking with lung cancer? Will you do a t-test or a chi-square test? Chi-square. Is this a quantitative data association? It is like qualitative. So very important word in the question that you should look for. If they're telling you that to look for the association or the proportion, for that you would do the chi-square. So association of smoking with lung cancer, it's a chi-square. Quantitative test is something, quantitative data is somewhere where you will have the average and mean being calculated. So if the question mentions this, average height, average blood pressure, so that means it is quantitative data, you will do the t-test. Okay, you will do the t-test there. So let's try to answer this. What is a non-parametric test to compare the qualitative data between two groups? Chi-square. Be it two groups or more than two, qualitative is chi. To compare the quantitative data, that means the question will give you mean and standard deviation in a single group. Single group is paired. Quantitative two group is unpaired. And more than two groups is ANOVA. Right? This is just the theory part of it. You need to apply this to the MCQs. Then only you will realize the questions kaise aate. Right? So do this homework for today. Practice the questions of the test of significance. That's why this has been happening. Right? So that completes